Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be talking about a before and after for a patient with spacing. So in this video we're going to be showing you how she started, some of the ways that we usually fix spacing in teeth, and then show you her final photos as well. So if you haven't yet, make sure to like and subscribe to the channel, and let's get started. So this patient, you can see she had some spacing top and bottom. That was her primary complaint. You can see with her bite's not too bad. Alignment's not too bad. It's mostly just spacing. She also felt like her teeth kind of stuck forward a little bit too far. And so we felt like if we could close those spaces, that should upright the teeth well and solve both of those problems. So some of the ways that we will close spacing with braces include elastic chain or power chain, closing springs, and closing loops. So we'll show you what those look like. Alright, so this animation is going to show you what power chain or elastic chain looks like. Alright, so with the wires in place, the elastic chain will be placed over top of the braces, and this elastic chain stretches kind of like a rubber band, and then it wants to close back together, and as it closes it pulls all those teeth together and closing up all of the spaces. And so you may have heard of power chain or elastic chain. That's basically what it is. It's just a stretchy string of elastics that go around the braces, and those will gradually pull the teeth together. All right, the other way that we may close spaces is a closing spring. So usually if we have a little bit more space to close, this is something we might use. So this spring, it's kind of stretchy, and so you would place it on the back tooth, as you can see in this image, pull it forward, and then hook it onto a hook or one of the brackets. And then that spring is going to want to close back together, and it's going to close those spaces as well. So it works similar to elastic chain. The reason we may use this rather than the power chain is that the power chain over time kind of fatigues. Just like if you keep stretching a rubber band, it starts to wear out over time. These springs tend to last quite a bit longer, and they will keep closing the spaces a little bit more than the power chain. And then the last way that we might close space is called a closing loop. So this is more if we have really severe spacing or a hard to close space, we might use this method. So how it works is we place this loop into position, and then we will pull that loop open. So it's kind of like if you can think of like a paper clip. If you stretch the paper clip open and let it go, it wants to spring back into place. It's the same principle where we'll pull that loop and then cinch it, and that wire is going to want to spring back together and eventually close that space up. So for our patient, we felt like her spacing wasn't too severe, and we thought that a power chain would probably be sufficient for closing her spaces. So we put braces on top and bottom, and then over several months we used our elastic chain, and it gradually closed those spaces up. And this is where she started, and this is her final photos. So you can see we were able to get all of the spaces closed, the bite fit together well, all of the gaps are closed. One thing to note is she does have kind of some puffy gums right in between those front two teeth. And that's fairly common whenever we close spaces. Whenever we close spaces, initially the gums will get kind of bunched up. All that extra gum kind of gets pushed forward, and you will see kind of some puffy gums. So most of the time that will resolve on its own. If it doesn't, we can use a soft tissue laser and remove some of that excess tissue. Generally, we'll give it a couple months to see if that gum tissue calms down on its own. Like I said, if not, it's easy to remove as well. So we'll look at her before and after photos. You can see we were able to get those teeth brought back quite a bit just by closing the spaces. We were able to get the gaps all closed. The teeth are sticking forward much less in this final photos, and she was very happy with her teeth. So this treatment took about 12 months. It was a pretty simple, straightforward case. Generally speaking, spacing is pretty simple to close as long as the bite and everything else is pretty okay. So this is how spacing is closed. Hopefully you found this video helpful. If you did, give it a like. Make sure to subscribe to the channel. And if you have any questions, make sure to ask them in the comment section below. And we'll talk to you soon. Bye-bye.